Hi, this is Robert Hanson with the Sacramento Observer. I'm here with Lauren Babb Tomlinson, who is running for the newly redrawn House District 6. Hi, Lauren.
Hi, Robert. How are you?
I'm good. How are you doing?
I'm doing well.
Okay. So we spoke before. You spoke a lot about your organizing. Give you an opportunity to tell everybody why you decided now is a good time to run for office and go from organizing to lawmaking.
That's right. So just a little bit about me. I'm by day the Chief Public Affairs Officer for Planned Parenthood and have been for many years. And in that role, I serve at the largest affiliate in the country. We have 42 counties in California and the entire state of Nevada. And I have been on the front lines fighting for reproductive health since before Roe fell. And this summer, when Trump and the Republicans gutted health care, unfortunately, Planned Parenthood was defunded, and we had to close 5 health centers. And I was the one that had to tell folks that we would no longer be able to provide family medicine, behavioral health, prenatal care. It was absolutely devastating because I know that those patients have nowhere else to go. Rural hospitals are being impacted, FQHCs are being impacted, and this is a public health crisis by design. And so it really just gave me the energy to get in the ring because we need to make sure that we have fighters in Congress. I'm also a mom. I have a 1-year-old son who I love deeply, and I just could never imagine him growing up in this world. I mean, the climate issues, he has asthma, and then what's happening in Minnesota is absolutely devastating. Folks are living in fear from their own government, and I can't imagine someone knocking on my door, kidnapping my kid, and that's just not the world that I want my son to grow up in, and so I'm ready to fight because he deserves more.
So about Roe versus Wade, what are the first steps you would take if elected to Congress? What's the first thing you would address?
The first thing I would do is get rid of the defund. So the defund provision is in H.R. 1, and it prohibits certain entities like Planned Parenthoods from receiving any federal match dollars. Obviously, you can't use federal dollars for abortion care, so it literally limits things like cancer screenings, breast cancer screenings, and birth control, and all of that. And so I would get rid of that provision immediately and restore access to funding to places like Planned Parenthood because it is a critical place for people to get their care.
And as far as the rulings that the Supreme Court made, what steps does Congress need to do to reverse that?
Yeah, there's some great legislation called the Whole Women Act that would essentially create more protections federally for abortion access as well as reproductive health care. And so we need to get that passed as well. And we also need to think about how are we looking at equal rights amendments so that we're a little bit more expansive than just the reproductive health care. Because quite frankly, health care you get shouldn't depend on your zip code. And the decisions that you're making in a doctor's office should be between you and your doctor and not the government.
And still staying on kids, child care costs are costing people quite a bit of money. What ideas do you have to help alleviate that issue for people?
Certainly, I'm feeling it in my own pocket. I
Yeah.
mean, my daycare is almost more than my mortgage, and then my son has the audacity to be sick, and I'm still paying for him to go to school. And many families in the district are feeling the squeeze on that. I mean, the reality is we need to really focus on comprehensive universal child care. Representative Ro Khanna has a bill right now that would alleviate some of those child care costs for working families, and that's something I strongly support because having childcare is the backbone of people being able to work and put food on the table.
So what issue do you see is the most pressing one in the area here in Sacramento and parts of Placer where you would be potentially representing?
Yeah, I mean, I think there's so much, right, that is impacting people, but mainly affordability and not just the buzzword of affordability, right?
Yeah, go in depth in that one.
Yeah, like really focusing on housing costs, right, and health insurance. You know, without the ACA subsidies, people are going to be paying more out of pocket for their insurance. And I've already heard from people in the district that they're just opting to not have health insurance. And so that's the difference between paying your rent or having your heart medication. And people shouldn't be making those tough decisions. And we in Congress have to do a better job to get people whole again. I mean, they just want to put food on the tables, have a roof over their head, and have good education. And so that's probably the other thing I hear a lot about is education. We were able to talk about how the WWE lady is running the Department of Education.
Sure.
And
Linda McMahon. Yeah.
and that's problematic because what she has done is completely dismantled the civil rights units in the Department of Education, which means that we don't have good enforcement of civil rights in our schools, as well as the funding cuts that are happening across the board. So we certainly need to restore the federal Department of Education and invest in education so that our kids are getting and learning about things like Black History Month and, they're not cherry picking what they're teaching our children.
The most paramount issue, unavoidably, is in Sacramento is the homeless crisis. Aside from just providing more housing, what other federal programs or what other ideas do you have that the federal government could do to help that?
We need to significantly invest in our crisis response teams and our community response approach. And so we need to put more dollars into programs that are already working. The care teams that are out there know these people well and they know what they need, and we need to invest in those resources. And we also need to think about more long-term housing, right? Whether that's a tiny home or whether that's transitional to permanent housing. But we need to meet people where they're at with the services they need. And time again, I think that there is this issue of mental health with not any resources or services to get people where they need to be. And follow-up, that's critical. And so what the federal government can do is provide resources and investments in programs that are already working in the community. And I would work with leaders here to identify those programs and get the dollars they need to expand. One thing that differs from some of the other candidates in the race is I do not believe that we should criminalize poverty. I myself am a bad day away from being unhoused. And so that is the lens in which I want to take to Washington, is that we all have to live in this community. And so it is a community solution that needs to be driven by the people that are there, and also prioritizing getting people mental health and recognizing that safety is important. I want my kid to be able to walk to school and not have to walk around an encampment or needles or something that's dangerous. But we need to also invest in how we get people well.
And explain crisis response for people who might not know, in detail. What do you mean by crisis response? What does that entail?
More social workers, more people that are working with direct nonprofits who work directly with the unhoused community. So they go out and they have conversations with them about what they need. And some of the stories that I've heard from these folks is they do want to get housing, but some of those housings comes with restrictions, right? So if they have a dog and their dog can't be there, or if they have kids and they can't all stay in the same unit. And so it's developing a relationship. That's what the crisis response teams do, and then getting them the resources that they need. And I hear time and time again that they just are overworked and underfunded.
So you brought up your opponents. Three of the main ones that I think of, Martha Guerrero, our district attorney Tin Ho, and former state senator Richard Pan. They all have held office, won campaigns. What's your plan to overcome people who have that kind of experience running campaigns?
Yeah, for sure. I also have run campaigns. I run and have run the PAC C4 for Planned Parenthood Advocates Marmonte for many years, and we endorse all state and local candidates. So very familiar with folks in the race. What makes me different is is the moment that we're in right now. Folks are not looking for the same old status quo. They're looking for new energy and fighters who are going to bring energy to the problem and create solutions. I'm not in this because I'm looking for a new job title. I'm in this because I know that I am bringing something to the table that matters for working families. I'm endorsed by a group called Vote Mama, who gets Democratic mothers elected to office. And one of the stats they use is that there are more men named John in Congress than mothers with young sons and children. So imagine if we had folks who were thinking about young working families in office, who aren't sort of looking for their next career to hang their hat on, and are just there to roll up their sleeves and get the work done for the people in the district.
So do you have an example where you had to negotiate with people who disagreed with your position and you came to an agreement and some type of compromise to get something accomplished?
Yeah, every day. I think it's really important to be able to work with people and turn the temperature down and figure out what they care about. I was the chair of the Commission on the Status of Women and Girls for many years. And in that role, I worked with all different kinds of folks. And one of the things that I'm really proud of was we created the first $5 million grant program for women and girls after COVID, because what we learned is they were disproportionately impacted because of caregiving. And to be able to do that, I had to go to the legislature and ask for $5 million, which is quite a thing to do as the youngest chair in state history. And how I did that was with the facts. I showed them that in the state budget at the time, there was only one allocation for women, and that was for Chowchilla Prison. And so I explained to them that in this moment, women and girls were being the most impacted by COVID, and we had the resources and we needed to make the investment. And so I made the case, and we were able to get that grant program off the ground and infuse dollars directly in our communities. That's just one policy option. I also work in the state of Nevada, where there's a Republican governor. This past special session, I was able to get $1.2 million passed in the Nevada state budget. How I did that was working across the aisle and making sure that they knew the importance of reproductive health care. And so I believe I can work with anyone. And the important way of doing that is to not think I have it all figured out. I want to have a conversation, learn what you care about, and see where we have common ground so that we can continue to build the relationship.
And regarding public safety, what is your position on law enforcement's role in public safety, as well as what public health experts say is needed to reduce crime? Recently, data has shown that California has actually hit its lowest homicide rate in since the 60s. And public health experts have said that was from a lot of funding that went towards violence intervention organizations and other services like mental health and supporting victims of crime. So what is your overall take on public safety?
Yeah, I mean, public safety is critical. I mean, if someone breaks into my house, I'm going to call the police. There's no ifs, ands, or buts about it. And so what we need to do is have a balance, right, where we are investing in the interventions for crisis response. We are creating avenues in which we are infusing dollars into the nonprofits that are able to sort of turn the temperature down and have a relationship in communities. And that's a partnership. It's a partnership with the nonprofits, and it's a partnership with law enforcement. But we also need to hold law enforcement accountable when something goes wrong, because the community is looking for that. And so I would love for us to have a federal, state, and local partnership to continue the good work and keep the crime rates low, and also be innovative in ways where we feel like we're going to be able to create more balance to keep people safe.
So is there an issue that you could think of that might disappoint moderate Democrats or your other Democrats if you were elected? There's an issue that you might break with Democrats on?
Issue that I might break with Democrats on. Well, I'm really, really upset with ICE right now. And
I think all Democrats are upset with ICE.
But they weren't, though,
Okay.
Traditionally, last year or 2 years ago, you saying defund ICE, that would have not been something that Democrats are leading on. And so I'm glad to see that they've turned the table on that. And so that, to me, just taking an aggressive stance on really moving those resources into safety net programs is important to me. I also support healthcare for all. So I really believe we need to focus on how we get to our North Star as a single
payer.
As a single payer, correct. And I don't really think about the issues that I take on as sort of moderate versus progressive. I look at it as, how is this going to make the district better, and how is this going to make someone's life better? And I work with anybody to get that done. And so I'm not afraid to work across the aisle. I'm also not afraid to work with progressives if that's something that's going to make the district better. So I'd have to come back to you on some concrete that I feel like is just so far from party lines. But I'm not afraid to say what I think and be a lone voice in that. And that's the difference in being a new generation of leadership, is that I'm not going to stick to the status quo. And I'm going to be held accountable by these voters, but I'm also not just going to toe the party line, because that's not what people are looking for.
So are you a defund ICE, or are you more of a reimagining ICE?
I believe that we don't actually need ICE. Like in the early 2000s, we did not have ICE. And the reason I feel that way is because of this president and how he has weaponized it to create violence and fear and state chaos in America, where Americans are afraid of their own government. And so my actual consideration is that this group could become a problem that impacts people's ability to vote and democracy. And so until I see that they actually have a role that is not going to harm the American people, I strongly want those resources to be put towards safety net programs that help people.
And so I asked about the one that might frustrate Democrats because there is a significant portion of your constituents in this district that are conservative, particularly in the Roseville, Rockland, the Placer areas further east that are more conservative. How would you connect with those voters and how would you try to win their vote?
Same way I would win anybody's vote, right? Like they've got families. I'm a mom. They know how hard it is to raise a family here. I recently was at the farmers market in Roseville, which you can kind of find me at on Sundays. And we do this thing called Man or Woman in the Street. And I ask, A, do you know what district you're in? And then B, what do you care about the most? And what I hear from folks all the time is they love their communities. And particularly in Roseville, there's a growing group of people that are moving there and they don't have enough resources, whether that's the roads are always congested or the schools can't keep up. But the number one thing that people are concerned about is, can my kids afford to live here? And the answer I keep getting is no. And that's a problem for folks that want to continue to live where they grew up and grow their families. I mean, young families are just having a struggle of a time to just be able to raise their families where they grew up. And that's what we have to solve for folks. And that's what people want to hear. They don't want to hear, what Republican, Democrat or that. They want to hear what real solutions we can create so that people can afford to live where they grew up.
And so what ideas do you have to help them do that?
Yeah. So housing, we need more first-time home owner incentives, right? Whether that's tax credits. I'm also really interested in this idea of how do we build housing that is based on what people can afford. So tying your income to your ability to buy a home. We also need to look at the electricity. So why is PG&E and SMUD and all of these electricity companies sort of starting to climb? Is there ways to create incentives so that we are able to have lower energy bills? And finally, we got to create good paying jobs. I mean, people need the ability to make good wages, and how we do that is investing in infrastructure and making sure that we provide resources in the district that allow small businesses to thrive.
Okay, so I'm going to move a little bit to some current events here. President Trump recently unveiled his low prescription website, where there's offers of, particularly the weight loss drugs and things like that, so to show much lower prices. What do you think about the president coming out and having his own website for prescription drugs?
Well, I think the president is taking a book out of California's page, right? Like we were the first to do it with lower insulin prescriptions, and Biden also did similar things where you negotiate the drug prices so they're lower. I think he is reading the temperature in the room of what voters know to be true, which is that this administration is creating a public health crisis. Folks are going to get their bills for their insurance, and it's going to be triple, quadruple what they were paying. And so that is probably the bare minimum of what he can provide when his party is ripping healthcare away from Americans. And quite frankly, if we're thinking about it, many people are going to stop getting preventative care, and they're going to end up in the ER, which costs us significantly more money. And unfortunately, people are going to die. So while I'm grateful for his website, maybe not grateful, but I'm glad he's addressing the fact that he is creating a public health crisis in which people cannot access their medications and is putting something out there, but not solving for what he's created, which is taking billions of dollars out of our healthcare, which will harm people in the end.
And he also had a post on his Truth Social, was a video made from somebody else that, according to the White House press secretary, the video is supposed to depict him as the king of the jungle amongst other Lion King characters. But also showed the Obamas as apes or monkeys. And now that the post has been taken down, what do you think about him posting something like that on social media?
It's disgusting that the president of the United States would even think that he was the king of the jungle. It's honestly shocking that this is where we're at in America. I am disgusted by a president that doesn't respect all people, and he is showing us the worst of what this country can be and has been. I mean, it has a history of all of the things we know to be true, especially in Black History Month. And I think the fact that he thought he could get away with this in Black History Month is telling of what his administration and what he believes about Black people in this country.
So, back to prescription costs. What would you do to lower prescription costs? What needs to be negotiated? What prescriptions are you aware of that cost people the most money? And
Yeah, I mean, it's really plan dependent, right? So I think what we need to focus on first is if the subsidies do not get extended for ACA, we need to start there, because if people just basically lose their insurance, then they're paying out of pocket. Using my own example, my son has asthma. With insurance, it's like $90 for the inhaler. Without insurance, it's like $2,000. So we need to make sure that people continue to have health care, full stop, first. And then once that is where we're at, then we negotiate the drug prices. The federal government has a huge power of the purse as it relates to Medicaid. And so we need to make sure that the pharmaceutical companies are paying or are giving us rates that are proportional to the dollar that the feds can spend. And so they've already done that under the Biden administration with insulin and other drugs, but I certainly would like to see that expanded, particularly in the space of, diabetes medication, heart medication, and prescriptions for children. But like I said, the true problem will become when people are just uninsured and they go without. And that means that it becomes everybody's problem, because now our hospitals are inundated with people who weren't getting preventative care. And then when you have a true emergency, where are you going to go?
so I take it from your response there that mentioning your son's asthma, that you support lowering drug prices for everybody and not just seniors, or would you even apply it to other people's private health care plans, or just Medicaid and Medicare?
I think we have to start with Medicaid, because those are the most vulnerable individuals in our system. And so, yeah, I think we should definitely start with across the board medications for folks that are on Medicaid or Medi-Cal. And then once we sort of establish a system, I definitely feel like we should continue that work on the private side. But like I said, my biggest concern is that people will just be uninsured and go without. And so how do we solve for that? Because that's where people will be. I mean, and in 2027, as written in H.R. 1, a significant population of folks fall off of Medicaid as is or Medi-Cal because of the eligibility requirements, which make it even harder, work requirements, re-enrollment, ton of red tape that's going to make it harder for people to just access care. And that doesn't even include our undocumented folks.
So, campaigns are full of big promises. Is there an issue that you want people to understand, that though you would be working on it, it's not something that will be fixed overnight or even in your first term?
Yeah, look, I mean, going into Congress, I'll be a freshman. I have a lot to learn, right? And so there are all the things that I want to do, particularly in healthcare, that I want to get across the finish line on day one. But you're still a part of an institution, right? And you've got to make sure that you're doing your homework and being strategic about what you can take on. And so for me, it's really thinking about what is my one thing that I have to bring home to the district. And for me, it's resources around infrastructure. And it would be thinking about how we undo all of the things that they've done in this Project 2025 landscape, as it relates to cuts to the DEI funding in research, as it relates to cuts around science, as it relates to cuts in healthcare. So I really want to focus on restoring the things that they have broken, and then getting really excited and innovative when we have hopefully a House, a Senate, and a president, right, to do some of the more expansive work that I know needs to happen.
And say you win, and we talk again in a couple years. What will need to have happened in people's lives for you to feel like you did your job in the first term?
I love that question. For me, I'm looking at the kids. Like, what kind of world are they living in? Do they feel excited to be an American? Because right now, you just can't, right? Do they have access to all of the educational materials they need to learn well, and it's not being censored by, like, Moms for Liberty, right? Do we have comprehensive investment in housing, affordable housing, and housing for working people where they can live where they work? Do we have affordable health care? Now, these are big things, but if we have moved the needle and I know that people are feeling a little less of a squeeze, then that will really that will make me happy, honestly.
And do you have any engagements in the upcoming weeks or in the near future that people in the community can find you at?
Yeah, I'm always out and about. Every Sunday, we pick a neighborhood, and then we go out there and do some conversations about what you care about and get to know us. We're traditionally at the Roseville Farmers Market. I'll be in March. I'll be at Tap Wine Lounge for a little bit of a meet and greet. So yeah, follow us on social media, lbtforcongress.com, and we post every week where I'm going to be, and I'd love to meet you and earn your support.
Well, thank you for your time, Lauren.
Thank you, Robert, and thank you for the Observer. This is great.
This has been Robert Hanson with Lauren Babb Tomlinson, who is running for the newly redrawn House District 6. And you can find stories about her and other things all related to Black Sacramento at sacobserver.com.